Hey, this is Dr. Brad here from Borson Dental. These are the top things you should know about Invisalign before you get started. So first thing is eligibility. So unfortunately not every single person is a good candidate for Invisalign. So the first thing we need to do is check your teeth, check your mouth, see if you're a good candidate for it, and we'll go from there. Alright, once you're a good candidate, the next thing is how long you wear them for. So you have to wear your trays 22 hours a day. You wear them during the day and at night when you're sleeping. And for how long you wear them, every case is different, depends on how complex and how much movement we're doing, but almost everyone falls within 6 to 12 months. So have that in mind for a time frame of how long the treatment will last for. Another thing that's important is you need to be committed to it yourself. You got to wear them all the time. You got to take them out when you eat, but you got to remember to put them back in after you eat, because if you're going to lose them, break them, get lazy about wearing them, then you're not going to get the results you want. So you got to be wearing them all the time, just taking them out to eat and putting them right back in. And the other thing about that with eating is when you eat, you got to brush your teeth, brush the trays, keep everything clean, because we don't want food sitting in between your teeth underneath those trays. That's going to cause more cavities from happening. So you got to be good about it at home, doing your part of it too. Okay, another thing to keep in mind once you start your treatment is you're going to have what we call attachments on some of your teeth, and those are little pieces of filling material that go on specific spots on certain teeth, and those help us rotate and turn teeth and move teeth in certain ways. So it's a little awkward and different at first, feeling those little bumps on some of your teeth, but they're barely noticeable, and that really helps us get the desired results that we want with your treatment. Another thing to keep in mind is, just like anything else that's new to you, there is an adjustment period with wearing the aligners. So they might feel a little big or bulky at first, but you'll get used to them really fast. You'll get used to taking them in and out. It's not going to be a terrible experience the whole way through. Those first few days is just going to feel a little different to you, but you'll get used to it really fast. Another thing is once the teeth start moving, it's normal to be a little sore because the teeth are actively moving. So a little soreness is normal for the first couple days, but again, it's something that's not going to last, and it's not going to be a big issue to you in the long run. So the very last thing is the refinement process at the end. So that's once we get to the end of your treatment. If there's any small tweak or adjustment you want to make it look exactly how you like it, or anything we notice that we think we could make a little bit better, we do refinements at the end. Sometimes we need to do a new scan, fit you for a few more trays, just so we can get everything absolutely perfect and exactly how we want it to be.